Welcome to our comprehensive guide on understanding the healthcare policy and practice in the United Kingdom. This video will take you through the intricate framework of policies, legislation, and organizational structures that govern healthcare delivery. Our journey will span across various regions of the UK, highlighting the unique aspects of each. By the end of this video, you'll have a clearer understanding of how healthcare services are structured and delivered. Let's dive in and explore the fascinating world of UK healthcare. In the UK, healthcare is predominantly delivered by the National Health Service, known as the NHS. The policies of the NHS significantly influence how healthcare is provided across the country. These policies are not static. They evolve and adapt to meet the changing needs of society. Understanding these policies is crucial for anyone involved in healthcare, as they set the framework for everyday practice. Join us as we delve into the key policies that shape healthcare delivery. Devolution has allowed different regions in the UK to tailor healthcare services to their specific needs. In England, Scotland's distinct system, Wales, and Northern Ireland, healthcare is organized and delivered differently. This chapter explores how devolution affects policy implementation and healthcare outcomes. Understanding these differences is vital for healthcare professionals working across the UK. Let's examine how devolution shapes healthcare in each region.
The integration of health and social care aims to provide seamless services to patients. This approach ensures that healthcare and social services work together to improve patient outcomes. By collaborating, these services can address the holistic needs of patients more effectively. This chapter will explore the benefits and challenges of integrating health and social care. Discover how this integration impacts patient care and service delivery.
The principle of choice empowers patients to make informed decisions about their healthcare. In the UK, patients have the right to choose their healthcare providers and treatment options. This chapter discusses how choice influences patient satisfaction and healthcare quality. By understanding their rights, patients can take an active role in their healthcare journey. Let's explore how the principle of choice is implemented in the UK. Legislation plays a pivotal role in shaping healthcare delivery in the UK. Key laws such as the Health and Safety at Work Act and the Mental Health Acts set the standards for practice. These laws ensure that healthcare providers maintain high standards of care and patient safety. This chapter will highlight the most influential pieces of legislation affecting healthcare. Join us as we explore the legal framework that underpins healthcare services. The Health and Safety at Work Act 1974 is fundamental to ensuring safe healthcare environments. This legislation outlines the responsibilities of employers to protect their staff and patients. Compliance with health and safety regulations is mandatory for all healthcare providers. This chapter will examine the impact of these regulations on healthcare settings. Discover how health and safety laws contribute to a safe working environment.
The Mental Health Acts of 1983 and 2007 provide a legal framework for mental health care. These acts outline the rights of patients and the responsibilities of healthcare providers. Understanding these laws is crucial for professionals working in mental health services. This chapter will explore how mental health legislation affects patient care and treatment. Learn about the legal protections in place for mental health patients.
The Human Rights Act 1998 ensures that patients' rights are protected within healthcare settings. This legislation guarantees fundamental rights such as dignity, privacy, and access to care. Healthcare providers must uphold these rights while delivering services. This chapter will explore how human rights legislation impacts healthcare delivery. Discover the importance of respecting human rights in healthcare practice.
Data protection is critical in safeguarding patients' personal information. The GDPR and Data Protection Act set the rules for handling patient data in the UK. Healthcare providers must comply with these regulations to protect patient confidentiality. This chapter will discuss the importance of data protection in healthcare settings. Learn how data protection laws ensure patient privacy and trust.
The Mental Capacity Act 2005 empowers patients to make decisions about their care. This legislation outlines how to assess a patient's capacity to make informed choices. Healthcare providers must respect patients' autonomy while ensuring their safety. This chapter will explore the principles of the Mental Capacity Act and its impact on care. Discover how this law supports patient-centered decision-making. The duty of candor requires healthcare providers to be open with patients about their care. This regulation promotes transparency and trust between patients and healthcare professionals. Providers must inform patients of any incidents affecting their care and the actions taken. This chapter will examine the importance of candor in maintaining patient trust. Learn how transparency is integral to quality healthcare delivery.
The Equality Act 2010 ensures that everyone has equal access to healthcare services. This legislation prohibits discrimination based on characteristics such as race, gender, and disability. Healthcare providers must ensure that services are inclusive and accessible to all. This chapter will discuss the impact of equality legislation on healthcare delivery. Explore how non-discrimination policies promote fairness in healthcare.
The Health and Social Care Act 2012 introduced significant reforms to the NHS. This legislation aimed to improve efficiency, quality, and patient outcomes. It established new structures for commissioning and delivering healthcare services. This chapter will explore the key provisions of the Health and Social Care Act. Discover how these reforms have shaped the modern NHS.
The CARE Act 2014 provides a framework for protecting vulnerable adults in the UK. This legislation outlines the responsibilities of local authorities in safeguarding adults at risk. It emphasizes the importance of prevention and early intervention in adult care. This chapter will explore how the CARE Act supports adult protection and well-being. Learn about the measures in place to protect adults from abuse and neglect.
Funding is a critical factor influencing healthcare service delivery in the UK. The NHS is primarily funded through taxation and government allocations. Changes in funding levels can impact the availability and quality of healthcare services. This chapter will discuss how funding affects healthcare provision and patient care. Explore the challenges of resource allocation in the NHS. Regulatory bodies such as the CQC and HealthWatch play a vital role in overseeing healthcare services. These organizations assess the quality of care and ensure compliance with standards. Their evaluations impact funding, reputation, and public trust in healthcare providers. This chapter will explore the functions of regulatory bodies in the UK healthcare system. Learn how oversight contributes to maintaining high standards of care.
The National Institute for Health and Care Excellence, NICE, provides guidelines for medical practice. These guidelines are based on evidence and aim to standardize care across the NHS. Healthcare providers use NICE guidelines to deliver high-quality, consistent care. This chapter will discuss the role of NICE in promoting evidence-based practice. Discover how guidelines shape treatment decisions and patient outcomes.
Patient and community involvement is crucial for shaping healthcare services. In Northern Ireland, organizations like the Patient and Client Council enable public engagement. This chapter will explore how involving patients and communities improves healthcare delivery. Learn about the initiatives that promote patient participation in decision-making. Discover the benefits of community involvement in healthcare planning.
In Northern Ireland, healthcare is managed by a unified health and social care system. This structure aims to provide integrated services for better patient outcomes. The Department of Health oversees the system, supported by local commissioning groups. Animationiki Kpulinksarkund Puvain Kor. This chapter will explore the unique healthcare model in Northern Ireland. Discover how integration enhances service delivery and patient care.
The Welsh Government controls healthcare delivery through 7 local health boards. These boards plan and deliver services based on regional needs. Wales also has national trusts for specialized services like cancer care and public health. This chapter will explore the healthcare structure and priorities in Wales. Learn how regional planning improves healthcare access and quality. In Scotland, healthcare is guided by national objectives set by the Scottish Government. 14 NHS boards are responsible for planning and delivering services locally. Scotland's approach emphasizes integration and community based care. This chapter will explore the healthcare system and reforms in Scotland. Discover how Scotland's model supports patient centered care.
Policies and legislation significantly impact the effectiveness of healthcare services. Key factors include funding, regulatory requirements, and adherence to guidelines. This chapter will explore how these elements influence service quality and patient outcomes. Understanding these impacts is crucial for healthcare professionals and policymakers. Learn how policies shape the healthcare landscape in the UK. Thank you for joining us on this journey through the UK healthcare system. We hope this video has provided valuable insights into the policies and practices shaping healthcare. Stay informed and engaged as you continue your journey in healthcare. Your role is vital in ensuring quality care and improving patient outcomes. Thank you for your commitment to understanding and enhancing healthcare services.